Hello, I'm Luke O'Neill and here in my lab in the Trinity Biomedical Sciences Institute. So this week on the COVID-19 update, the common cold. One study has just come out showing that if you have the common cold, which is a similar virus to the one that causes COVID-19, you can get reinfected. Now it might be less severe, but people can get reinfected. That worries us a tiny bit because it might mean that if you do get COVID-19, you are at risk slightly of getting reinfected. Hopefully it'll be a less severe disease and therefore having it will give you a bit of protection in the future. Also of interest, the big relentless effort to get testing to be better, and there's a great phrase now, testing anytime, any place, anywhere, and great progress is happening. So many companies are developing ways to test for this virus, and very importantly, a clever technology called Crispr. And Crispr is a way to measure the RNA in the virus in a really accurate, rapid way. Crispr tests will start to roll out. They'll be quicker, they can be done in your house, in schools and airports, and the hope is this may begin to replace the testing regimen that we now have. So these developments will really help us in the future. And vitamin D. Now, that's a vitamin we all know about. For years we've known about vitamin D. It builds strong bones. There's been evidence vitamin D is very good for COVID-19. If you're an immunologist, you know vitamin D is a great way to suppress inflammation and get rid of some of the damaging effects of the virus. Secondly, it may actually be antiviral. It triggers a thing called autophagy. Very technical word there, but it's a way to chew up the virus. And there's studies showing already clinical trials with vitamin D supplementation, perhaps showing benefits. Early days, but vitamin D might be a way to help people. And then for me, it's been very busy this week because we managed to do a big collaboration with the drug company Roche to take our drugs to the clinic, and we're doing things like Alzheimer's and Parkinson's. Very excited about this because Roche have very deep pockets. They can fund these clinical trials. Drugs are very expensive, remember, and to make a drug and discover one takes an awful long time. My own work on this began in 1985, if you can believe it, a long time ago. So all this effort takes money, it takes time, it takes investment, and of course the hope is that new medicines come out of this that will benefit patients. And also there may be a COVID angle. So Roche are working on COVID and they've got several programs running against COVID, and now we can help them there as well. So it's a very exciting development. So you'll hear all about these stories and more on my weekly update about COVID-19 on Newstalk with Pat Kenny.